That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other. Well, hey, everybody. Welcome back. This is Real Health with Brandi and Amir. I'm Dr. Amir Rashidian, and this is Brandi Rashidian. And this being Real Health is where we teach you how to feel better, get stronger, live longer, and feel younger. And as you may already know, hopefully you've been watching all episodes so far. We're gonna look at the headline news when it comes to health and see what's on the news, what people are talking about, what the media is reporting on. We're gonna summarize those, explain them to you, and let you know what it means to you and how to apply it to your life to make sure you are actually getting healthier. So why don't we dig right in? Last time we were talking about how there was some news about aspartame, the sweetener, and how the World Health Organization is calling it a carcinogen, which means it can cause cancer, but it's still safe, and they haven't changed any of the amounts and so on. And we said we would start this one with that article. So the article title says soda sweetener aspartame now listed as possible cancer cause, but it's still considered safe. This is by Associated Press. The World Health Organization Cancer Agency has deemed the artificial sweetener aspartame a possible cause of cancer, while a separate group looking at the same evidence said it still considers the sugar substitute safe. So,
that's a little confusing. I wonder why it is that we have something that has been on the market for years that most of us have known it's not good for us.
Yeah.
It's not the only one that we would be concerned about, right?
Yeah.
There's several on the market that that we would not want to have in our bodies at all. But like, we've known this. They've known it.
Well, I remember back in the 80s, I'm aging myself, but I came to America in 85, and I remember, we'd be sitting at restaurants, and they always had those little
Packets.
Yeah, boxes with the packets inside,
Yeah.
and like half was sugar, and then half was sweet and low, and then there was this one called Equal. The sweet and low had the pink packets, and the Equal was blue.
Yes.
So I looked it up to see, because I remember looking at those packets, and now they don't say this anymore. But in the old days, the packet said may cause. In research, this has caused cancer in laboratory animals. That's what it didn't say. It can cause cancer in humans, but it said, but sweet and low had saccharin in it, and aspartame was an equal. So the blue packets had aspartame.
Interesting.
And but they removed that. So maybe later research said it's safe. But there are others. There's Splenda. Splenda has sucralose. So sweet and low has saccharin, and Equal has aspartame. They're all sweeteners.
Aren't there high levels of chlorine also in Splenda?
I don't know. I'd have to dig more deep into it. I have heard that. I don't know if that's hearsay.
We have to look that up. I wish I would have looked at that beforehand, because I remember that being something, that really steered me away from.
Yeah, something with burning of chlorine is what leads to, but I'm not sure. And then there's erythritol, stevia, monk fruit. Those are other sweeteners. Those are considered more holistic and safer. This article, it said on Thursday, July 13, 2023, the International Agency for Research on Cancer and Cancer Research arm of the World Health Organization deemed aspartame the world's most widely used artificial sweetener to be possibly carcinogenic to humans. Separately, a UN expert group assessing the same evidence said their guidance regarding safe consumption of the sweetener remained unchanged. The World Health Organization's Cancer Agency has deemed the sweetener aspartame found in diet soda and countless other foods. It repeats that, about being a carcinogen, but it is in a lot of sodas.
Yeah.
The differing result of the coordinated reviews were released early Friday. One came from the International Agency for Research on Cancer, a special branch of the World Health Organization. The other report was from an expert panel selected by the World Health Organization and another UN group, the Food and Agriculture Organization. So that's why, like, one said it causes cancer, the other says it's safe. And they're basing it based on the amount.
Yeah, I I would say, I think what's concerning is if you look at most of the sodas, very few actually contain real sugar
Yeah.
these days. So it's either high fructose corn syrup, which we all know is not, that is also not something that we should be putting into our body, especially in high levels. But it's in all of our food sources.
Yeah.
Not all, but a good deal of them, enough for us to say all of our food sources. So I mean, the bottom line is anything that is chemically produced,
Yeah.
right? You run the risk of it being found that it's not good for you. Our
Yeah.
our bodies are not created to take on the amount of chemicals, especially that are put in our food,
Right.
that our bodies are made to take on food, not
I didn't
chemicals.
know aspartame is used in cough drops, and
Yeah.
and certain medications, especially and foods considered diet foods. Obviously, diet drinks,
Right.
desserts. Chewing gum has aspartame in it.
Yeah, well, that's one of the reasons we stopped chewing
Yeah.
just run of the mill chewing gum that you
Yeah.
get at the supermarket.
Right.
We actually order ours offline. Number one, we didn't want the sweetener in it, but we also didn't want regular sugar in our gum because we didn't want our blood sugar spiking every, couple of hours as we're just chewing
Well,
gum.
yeah. So here's the thing: if it actually has real sugar, that's okay, because then sugar goes in your blood, insulin gets released, and it pulls the sugar into your tissues. And if your glycogen levels are full, then that sugar becomes fat, which actually is not a bad thing, unless you don't want the fat. Some people don't.
Most of us don't.
However, when it tastes sweet, but there is no sugar in there,
That's the real detriment.
that's when it's bad, because then the brain thinks sugar's coming, because as soon as your tongue touches something sweet, the brain says, okay, release the insulin. Insulin gets released, goes to all the insulin receptors and wakes them up. But if there's no sugar, then the insulin receptors start to ignore. It's like the boy who cried wolf.
Right.
Hey, there's a wolf, there's no wolf. The other shepherds ignore you after a little while. All the insulin receptors ignore the insulin because they think there's no sugar.
So isn't it ironic then, right? Knowing this, that then when somebody is diabetic, we tell them to go drink a diet soda, right?
Yeah. Well, type 1 diabetes, that's fine, because
Okay.
they're not producing insulin. Type 1 diabetes or juvenile onset diabetes, not an issue. If it's type 2, now we can't call it juvenile anymore,
Right. We
because
read an article
a
about
lot
that
of yeah, a
recently.
lot of kids are getting type 2 diabetes. Type 2 diabetes, the artificial sweeteners are actually not good for you, because you still release the insulin and you make your insulins more resistant. Type 2 is insulin resistance. Type 2, your pancreas is producing enough insulin, your receptors are just not responding to it.
Yeah, sometimes I wonder, we have the whole chicken and the egg thing, right? I go, is it our food sources and us wearing out our insulin receptors by, so many people will do diet sodas or diet food products thinking that that's the better thing to do
Yeah.
because they're reducing
Yeah.
their sugar
Or
consumption.
what bothers me is the labels will say safe for diabetics, but it's only safe for type 1 diabetics.
There you go.
All right. Sorry, I'm a foreigner. I'm allowed. Uh, my tongue didn't come through customs yet. And type 2, I mean, we shouldn't even call them the same
agree.
thing. We should change it. We should say insulin resistance and non-insulin, or insulin resistant and insulin dependent,
Right.
or something like that. So if you're type 1 and your pancreas isn't producing insulin, you can eat the aspartame, you can drink the diet soda. It's not going to harm you as much as someone who is not yet diabetic.
Right. And we're talking, it's not going to harm you more from an insulin perspective,
But
right?
it does. They do say it does. Let me read you the history here. It says aspartame was approved in 1974. That's the year I was born. By the U.S. Food and Drug Administration with an acceptable daily intake of 50 milligrams per kilogram of body weight. According to the FDA, a person weighing 132 pounds or 60 kilograms would need to consume about 75 aspartame packets to reach that level. So you have to eat 75 packets of equal if you weigh 132 pounds for it to be too much for you. Say that means it's also safe to drink up to 14 cans of diet drink a day. 14 cans.
For the record, it's not.
So
It's not safe.
that's why the other organization said it's safe.
Right.
The move comes weeks after the World Health Organization said. I don't like to say the Who because it makes me think of
The band.
the band. Yeah, so I can't say the Who, but I'll say it. Move comes weeks after the Who said that non-sugar sweeteners don't help with weight loss and could lead to increased risk of diabetes. There you go. Heart disease and early death in adults. So it's not just the cancer we're worried about; it's those other things. Just avoid anything that's not real. And then obviously when it comes to cancer, you've got epigenetics has a big role in it. It's your environment. One thing never causes cancer. I'm
Correct.
telling you, it's
like, what
multiple
is your
things.
other toxic load, right? What are the other
Exactly.
things contributing? So,
Exactly.
and we usually say don't change just one thing 100%.
That's right.
Take 100 things and change them by 1%.
That's right.
To make the biggest impact on
That's right.
on your health, right?
So if you love aspartame, eat less, but then do something that counteracts it. That's anti-cancer, like eat more broccoli and cauliflower and
Yeah.
and cruciferous vegetables.
Make sure your water's clean. We read about that last week.
That's
Yeah.
right.
So
Previously classified, what is this? The agency previously classified processed meat like hot dog, bacon as cancer causing as well. So, if you let aspartame, reduce the hot dogs and bacon, which would be very sad, especially the bacon part.
oh, bacon. I love bacon.
And it says they can cause colon cancer. There was another article on the same topic. Who declares widely used sweetener aspartame a possible cancer cause, but intake guidelines stay the same. This one was by CNN. The other one was Associated Press. And I highlighted a couple things that were different in this one, maybe possible link between aspartame and liver cancer. So
Interesting.
So, hot dog bacon can cause colon cancer. Aspartame can cause liver cancer.
So let's talk about that, because the liver is what like processes through a lot of those toxins, right?
Right.
So maybe there's
The biggest detoxifying agent in your body or organ in your body is your skin. The second one is the liver.
right.
But the liver is probably the most valuable.
Mhm.
I mean, obviously, if the heart stops, we die pretty
Well-
quickly. But liver is right up there with the heart and lungs.
And isn't the liver in charge of, we said it's detoxifying, right? So it handles, is it phase 2 of detoxification? The liver does. And so, but
it does both phase 1 and phase 2, I think.
but it's also limited in the number of processes that it can do at once. So it's not unlimited. Like our brain
Right.
can take on so much, right? It
Right.
has so many processes
Yeah.
that it can handle simultaneously, but the liver is limited.
But the liver also produces your energy. Your liver also handles metabolism. Your liver produces bile that gets stored in
Histamine.
your gallbladder. Yeah, processes histamine. There's a lot of things. Your liver produces cholesterol, both LDL and HDL cholesterol. Produces triglycerides.
Yeah.
It reprocesses those. So the reason they say HDL is the good cholesterol and LDL is bad cholesterol, which I don't like those because it's discriminatory.
In this day and age, we
It's
don't need more of that.
prejudice against cholesterol. I don't like that. We don't want to call any kind of cholesterol bad. We don't call any kind good. It's just cholesterol. But what happens is the liver produces HDL. HDL goes into the blood, grabs the LDL, brings it back to the liver to reprocess.
Right.
So the liver literally does dozens of
Yeah,
things.
and detoxification will get pushed back to the back burner for other processes that the
That's
liver
right.
is doing,
That's right.
or managing.
So like if you drink a lot of alcohol, then it's going to be really hard for the liver to focus on detoxifying your body.
right, or aspartame, right?
Aspartame, yeah.
So those are the things that you have to know is what part of my body is in charge of this, and am I creating such a toxic load that it's not going to be able to do what it needs to do for my body
Right.
so that I can function well. So these are the things that create that toxic load. So you
Yep.
have to be cautious. What's next?
As my next one, I have Pfizer.
Mm.
So the drug company Pfizer, a tornado apparently ripped the roof off of one of their manufacturing plants. This is by the Associated Press. Tornado damage to Pfizer plant will probably create long-term shortages of some drugs hospitals need. Apparently it's not just hospitals, some doctors' offices and so on. So it put even more pressure on already strained drug supplies at U.S. hospitals, experts say. And a lot of the material for our drugs and so on come from China. And so that's been a concern as well as tensions increase between different countries. Wednesday's tornado touched down near Rocky Mount, North Carolina, and ripped up the roof of a Pfizer factory that makes nearly 25% of Pfizer's sterile injectable medicines used in U.S. hospitals, according to the drug maker. No serious injuries were reported. I thought that was important to know.
That's very important.
The plant makes drug for anesthesia, medicines that treat infections, and drugs needed for surgeries. So that's pretty serious. I mean, even if you're not a fan of a lot of drugs, you still don't want to have shortage of anesthesia if surgery is required.
Sure.
And so there's more than 1.4 million square feet of manufacturing space in this one plant. That is enormous.
That's huge.
It's equivalent to 24 football fields. Over 2,000 people work in this one plant.
That's a good size establishment.
Good thing they didn't get hurt. It'll likely lead to some long-term shortages while Pfizer shifts production to other locations or rebuilds. Some hospitals have already started increasing inventory to kind of be prepared for that. But I mean, if they're hoarding it and holding on to it, and someone has less.
Yeah.
So that's interesting. And then some of them are switching to like antibiotic pills instead of IV. Hopefully it's as effective. Overall, there were 309 active drug shortages in the U.S. at the end of June. This is before the tornado. So there were already 309 active drug shortages, according to the University of Utah Drug Information Service. That's up from 295 at the end of last year, and the highest total recorded since 2014.
So where is the commission? Where's the department that is working with people in the US to maybe reduce the number of drugs they're on so that a shortage like this
wouldn't that be great?
doesn't
I mean,
hit us
yeah,
quite so hard?
because we just keep going. Okay, let's give more access to more drugs to more people. I go,
Right.
why don't we make people healthier so they don't need the dang drugs?
Right. And we need to then stop calling it a healthcare system. We're an acute care system.
Yeah.
We're a sick care system. And that's not a hit to our amazing doctors and nurses and first responders that are there taking care of people that need to be taken care of. We love and appreciate that. If, God forbid we get into an accident or we have an injury and we're here and our leg is over there, take me to the hospital, give me the best, give me
some painkillers.
Give me some painkillers.
Sew my leg back on.
100%.
Don't
right?
call the chiropractor.
Correct. Well, after, then you'll need an adjustment. So he has a place too. But the reality is there's so many times that we know firsthand people are just given things they shouldn't be given, or maybe there's an alternative route, or maybe we didn't even investigate if there was something else. Maybe their diet changing, maybe supplements, maybe. And I know there's a vast.
Here's one. Everybody who goes to the doctor with the common cold or the flu gets prescribed antibiotics.
Even if it's viral, just in case.
Well, they know it's viral. They say it's viral. So it's viral, but we're going to give you antibiotics to prevent a possible secondary infection that could be bacterial. But, maybe it's not necessary. Maybe that's why we're creating these superbugs.
Right.
Like MRSA.
I have a whole toolkit full of things, and as soon as I hear one of us or one of our team members or a family friend is under the weather, I'm like, go get this, go do this. There's a whole number of things that you can do that will boost your body's ability to be able to handle those things, and stop viewing
please
everything.
Don't get us wrong. We're not anti-drug.
No, not
but
at all.
We are pro-health. We would love to see everybody reduce the need for long-term medication use.
Right.
Some people are shackled by their literally bag of drugs.
Yes.
They can't go on vacation without packing their medicine bag.
Right.
And it's like a full medicine cabinet. Yeah. Our medicine cabinet has like toothpaste and what else? Floss. That my razor. I mean, I don't think there's medicine in it.
Yeah, there's not.
But then there's I've seen some medicine cabinets which has the top two shelves are prescription drugs, and then it's the Tylenols and aspirins and all that.
We see patients every day. Rarely do we have a patient come through that doesn't have a medication list.
There was something like the average American annually takes 12 or 16 different
Yeah,
prescription
we'll have to look
meds.
that actual number up. That
Well, this article
it's
was
high.
also reported on by New York Times as well, but it was the same thing for both of them. Do you want to talk about the 18-year-old in Nebraska? This is a hot topic. She had an abortion at 28 weeks of pregnancy illegally. So this is reported by the Associated Press. 18-year-old Nebraska woman sentenced to 90 days in jail for burning fetus after abortion. Hundreds of people descend on this. There was a picture of the article that the description of it, the caption of it was hundreds of people descend on Nebraska Capitol in Lincoln on May 16, 23 to protest plans by conservative lawmakers in the Nebraska legislature to revive an abortion plan. An 18-year-old Nebraska woman was sentenced Thursday, July 20th to 90 days in jail, followed by 2 years of probation for burning and burying a fetus last year after she took medication given to her by her mother to end her pregnancy. Celeste Burgess, did I say that right? Burgess?
I think so.
Was sentenced after pleading guilty earlier this year to a count of concealing or abandoning a dead body. So it says the abortion well into her third trimester violated Nebraska law at the time that banned abortion after 20 weeks of gestation. Officials have said Jessica Burgess ordered abortion pills online, which she gave to her then 17-year-old daughter. She's now 19 years old, I guess. 17-year-old daughter in the spring of 2022. She faces sentencing on September 22nd. So the mother is facing sentencing on September 22nd for acting like a doctor to give her abortion pills, and she could get 5 years in prison.
Yeah. I mean, this is such a, I know this is such a hot topic with, there's people on both sides, the right to life and right to make your own choices about your body. Um, it is such a hard topic. Here's where my heart goes out to Jessica and Celeste is I think sometimes we make choices not knowing or fully understanding what the emotional and mental repercussions are going to be. And for Celeste, who, you know, she's the one then who burned and buried her own child,
Yeah.
at the age that baby was, it's a
I have
baby,
numbers
and
for that because this was this story was also reported on by BBC News. Nebraska teen jailed for illegal disposal of her aborted fetus, and this is the one that said it was 28 weeks. The other article said just third trimester. Now I looked it up. At 28 weeks, chance of survival for a fetus is 80 to 90%. So there's 80 to 90% chance that would have been a viable fetus
right.
live, like they actually look like a baby. And then I found out that at 28 weeks, if a baby's born at 28 weeks of gestation, there's only a 10% chance of that baby having any long-term health problems. So there's 90% chance baby's going to survive, and 90% chance he or she is going to survive with zero health problems, like perfectly normal. 28 weeks. That's pretty sad. And I also looked up that a baby after 24 weeks has a high probability of survival. So this was 28 weeks.
Yeah, it's, man, I mean, I'm saddened for the baby that, whose life is over. I'm also very sad for the mom and the grandmother because they are going to have to process through that for probably the rest of their lives.
Well, they wouldn't have even been caught. Apparently, it was they were communicating with each other on Facebook, where everybody can see. So otherwise, I mean, the police wouldn't have actually. Initially, the police asked her what happened to your pregnancy, and she said, "I delivered a stillbirth." That's what she told the police, which no one would have known if that's a lie or not. But then they looked at Facebook, and they were communicating with each other about, oh, get the pills. Oh, I can't wait to fit in my jeans again. And
Uh,
I mean, the conversation's kind of
there are
disturbing as
so many
well,
things about this story that we could point out. Um, but
which makes me wonder how often does it happen where it doesn't get reported
I'm
or
sure
caught? Yeah.
it's way more than any of us
And
would
how
need
is
to
it
know.
that they can get abortion pills so easily?
When we just read last week that right now just birth control is becoming available over the
One
counter,
brand of birth
you know?
control, yeah, for women, yeah,
Yeah.
and so probably the others will follow suit,
Yeah.
and it'll be over the counter.
Yeah, for sure. So hopefully we won't read too many more like this. It's very sad.
So I have another article here. This one's by NPR. Russia's nixing of Ukraine grain deal deepens worries about global food supply. So there's a lot in this article. It gets a little political. Um, on July 17, the Russian government announced that it was pulling out of a deal to facilitate the export of millions of tons of grain from Ukraine ports. The arrangement had been in place since July 2022. So a year later after making this deal. So remember, the war started in March, I believe,
Yeah.
right? Russia invaded Ukraine in March, or attempted. The Kremlin's move immediately sparked concern, particularly in food insecure countries.
Mm-hmm.
The Kenyan government was quick to denounce the withdrawal as a stab in the back for drought hit nations in the Horn of Africa. UN Secretary General Antonio Guterres said that Russia's withdrawal will strike a blow to the people in need everywhere. So, grain prices have already been fluctuating. They use this thing called Chicago Wheat Futures, which is a global benchmark for prices. By Wednesday afternoon, Russia announced that all ships in the Black Sea bound for Ukraine ports will be considered potential military cargo starting Wednesday, and that jumped the prices by 9%.
Yeah, that's what's really funny is I didn't see in this article where China has been complaining about this because China actually receives the greatest amount of
Grains?
grains from Ukraine than anyone else.
Interesting.
So,
Well, I mean, the article said apparently their production had already dipped prior to this agreement, but so Ukraine grain crisis unfolded in March of 22 when Russia invaded its neighbor. Ukraine had been one of the world's largest exporters of grain and sunflower oil, which reached hundreds of millions of people in low resource countries. Russian forces imposed a naval blockade on Ukraine ports, immediately engulfing the world in a food security crisis. Food prices soared as millions of tons of grain exports were stranded for 5 months. Hope arrived in July of 2022. Turkey and UN negotiated a Black Sea grain initiative, enabling cargo ships to pass safely out of Ukraine ports to the Bosporus Strait. Did I say that right? From there, a joint inspection by Ukrainian, Russian, Turkish, and UN officials. So basically, they would inspect to see if there's weapons on checking to see that no weapons are on board. Vessels proceed to their destinations around the world. According to the World Food Program, the initiative allowed over 725,000 tons of wheat to be shipped to Afghanistan, Yemen, and East Africa. Russia has been criticized for dragging their heels. So what happens, even after the agreement, Russia was criticized for dragging their heels on inspections and repeatedly threatening to pull out of the deal. So they kept threatening, I'm going to pull out, they pull out of the deal, and then they finally pulled out of the deal.
I have to say I'm impressed that they're even allowing it to go through. I mean, they're in the middle of a war. You know what I mean?
Yeah.
So the fact that anything is getting out, I think is quite impressive as it is.
Well, now it's not getting out.
Well, or it was.
Areas like the Horn of Africa and the Sahel have suffered from chronic food insecurity for a long time. Families skip meals, eat less nutritious food. This leads to an increase in malnutrition, which harms immune systems and causes outbreaks of fast-spreading diseases like measles and cholera.
Cholera.
Cholera. Turkish President Recep Tayyip Erdogan said on Monday that despite Russia's curtailment of the deal, he believes that Vladimir Putin wants the grain deal to continue. Some speculate that Russia may demand relief from sanctions imposed by the West in exchange for its resumption. So maybe if the U.S. eases up on some of those sanctions, they'll allow the grain to flow through. But this could lead to a serious drought, and that would be the main concern.
Yeah, still a lot. I think we'll be seeing still a lot of issues coming from that region for quite a while. And so we can expect now, although we do also in the US expect imports from Ukraine. So some of our grains are also from there.
Right.
So, unfortunately, I feel like every other article we've hit last week and this week is all about, a struggle to get the things that we need, which maybe this is what's contributing to a lot of the increases that we're seeing across the board, so financially.
Oh my gosh, yeah, prices are through the roof. I'm
Businesses are struggling.
surprised. Yeah, economically there's a big strain on everybody, and I mean it started with the supply chain issue back when that ship got stuck in the canal, and since then things haven't been the same, and if anything happens in Taiwan, then we got another chip shortage, which can be not potato chips. We're talking about other chips.
I just like my kids would freak out.
So I think we're out of time. We had 3 other articles that we could probably push to next time.
Yeah,
and
sounds
go
good.
from there. But I think we covered quite a bit. Be careful how much aspartame you're ingesting. A little bit sounds like is safe as long as you're doing other healthy things, exercise and sleep and so on.
Yeah.
And
But with the potential concerns, if you can get rid of it, get rid of it.
That's right. That's right. Well, thanks for joining us. Tune in again next time. We'll go over all the news, and hopefully we will have some exciting, maybe some good news. Let's look for some good news, positive stuff
That sounds
next
good.
time. Well, take care. God bless. We'll talk to you soon.
Bye.